All right, wound care. Something that's often forgotten. A lot of people think when you have surgery. So my collarbone fracture, I got surgery, got an internal fixation, so a pretty long incision there. And ultimately, when I got out of the hospital, they had a bandage over it, a white mesh tape called Effects or Vifex with a gauze pad over it. They obviously sutured it, stitched it up to hold it together. And after 2 days, I had my first shower. So how do you protect it? Because once you peel off that, are you just going to, because you have to be careful about getting water, dirt, bacteria in it, because it's a full thickness incision all the way down to the bone. So you want to avoid any risk of infection and you having it potentially heal improperly. Also, with the long-term effects, scars affect your movement because your skin is a huge sensory organ, among other things. So if it doesn't heal well, it's stiff, thick, painful, sensitive. It affects your movement, it affects you down the road. So to start, to be able to have a shower while it's still healing, I use a product called Tegaderm. I found it at my local pharmacy. It's not always at the typical pharmacies like Shoppers Drug Mart, the big one, but it's a small pharmacy down the street from me where my doctor's office is. I knew he had this type of product. So I went and found the appropriate size and bought it. And after this little chat, I'll share a video of me taking off my dressing and getting this on in the shower. So basically what Tegaderm is, you might be able to see it. If I come close, you can see there's a sheet. It's a clear film that is waterproof. It doesn't allow water or bacteria, dirt to get through it, but allows your wound to heal, to breathe. And it can actually also, think about like your fancy waterproof jacket, you probably spend like $400 or $500 on. And it has that millimeters squared or cubed rating to it, like 10,000 millimeters. And it has to do with how, it is waterproof, water won't be allowed in, and that's why it beads off or runs off. But if you sweat, so water vapor will be expelled from it. So this is something I've actually used a lot, not just surgical, but as an athletic therapist working in professional hockey. Because there'd be abrasions, cuts, even if the surgery and equipment was going over it, and obviously hockey was not the most sanitary thing in the world, but we'd use it to cover for a game or a practice to help protect it. So I've been very pleased putting this on once I removed the original dressing. I've been able to shower. You can barely tell it's there. I've been able to pop in the shower now. It's waterproof, although I'm not potentially causing a problem with the incision. I can look at it, see it. It's not like I have to have a day or two to change your dressing every single day, because it's also beneficial. This is not weeping or it's not oozing fluid. It's not bleeding anymore. There might be a difference if you have one that is still after a few days still bleeding. Tegaderm. There is Tegaderm that the film might not be enough. There is versions of this that have some absorbency stuff, but check with your pharmacy, check with your doctor, whoever you're managing with, to get a better product. Because I'm not an absolute expert on this exact product, but I was able to find one that works for me for my thing. Then down the road, working on the scar mobility is a big thing because think of like the swelling, the inflammation, the bleeding that goes on with the surgery. It is like a glue. It's like pouring liquid glue all over a stack of loose leaf paper, and it absorbs it, and then layers after layer. So if you don't move the layers, like they just glue and stick together, and it'll create problems down the road. So I'll link the video of me putting this on so you can kind of see what it entails. Hopefully it's helpful. Anything to do with collarbone fractures, please get in the comments, get in my DMs, ask for any help about what to expect. You never want to go through an injury like this alone without the knowledge of what to expect. So thanks for watching this video. Hope it helps. Alright, time for the unveiling. Get this bandage off.
go. Yep, just got it all. All right. Tegaderm waterproof barrier. It also breathes, so it has membranes in it that are small enough that the wound can breathe. But water and contaminants won't get inside. Oh, yeah, that's sensitive. All right. There you have it. Time for the first shower after surgery.